8th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hey, we're back, and we have several news articles, actually scientific studies. One is a report from ASCO, which is the National Society. It's the largest society of chemo doctors, and they've now agreed with the surgical doctors called SSO and the radiation doctors called ASTRO in guidelines for women with breast cancer who want to save their breast, how much of the cancer in breast should be removed. And the answer is try to leave the breast alone, really. So what happens if you have lumpectomy? Remove the lump of cancer. How much of healthy tissue should be removed around that lump of cancer? Well, the answer is just enough so that when the doctor removes the lump, he rolls it around in ink, it's looked by a pathologist, the cancer cells shouldn't be on that ink. But other than that, you don't need a half an inch or quarter inch or inch no. The more healthy breast you remove, the more deformity there's going to be in the breast. And our goal is to cure the woman, obviously. We want to cure that woman so she has a normal life like any other normal woman her age. And we want to give her, or we want to leave her breast alone so it looks like it always did. And like it looks like the opposite breast. So there's guidelines, and these guidelines are telling you that. Now, I've had some patients who come in to me with 1 millimeter margins, and their surgeon is saying it's not enough. They need more. And the surgeon even tells the woman, if you go somewhere else, they'll tell you don't cut more, but I'm telling you cut more. Well, here's the guidelines. The guidelines are provided, and yes, if the positive margins, if there's cancer at the ink, then there has to be a little bit more tissue taken, and that can easily be done. But in general, if there's no cancer at the ink, that's enough. The recommendations were that negative margins or no ink on the cancer optimize breast tumor recurrence, and wider margin widths do not lower this risk. So again, stay away from the surgeon. Remove the cancer, but let's leave your breast intact. You're going to get better results. You're going to get better cosmetic results. You're going to get excellent medical results, an excellent chance of living your life. So stay away from excisions that are removing your healthy breast when the tumor has been completely removed. This will affect many, many women. There's 250,000 women a year with breast cancer. For most women, women have the choice of keeping the breast or losing the breast. There's new scientific studies showing that women who keep their breast, have lumpectomy and radiation, have a better chance of being cancer-free and alive than women who lose the breast. And again, just like for men with prostate cancer, many surgeons say if you remove the prostate, you're going to be home free, and we just talked about that. The data doesn't back it up, and the data doesn't back it up for breast cancer either. Losing your breast doesn't enhance your chances. In fact, the contrary. It diminishes your chances, and you'll have that reminder every moment of your life for the rest of your life about your cancer. Women who have lumpectomy and radiation generally get back to their normal life. Their body's pretty much intact, most likely are healthy, living their life. So this is a very important recommendation. I urge you to come in if you have breast cancer and talk to us about it. We have been a big advocate for saving breast, for breast preservation, even in the face of breast cancer. I came to New York in 1987 when in New York, 97% of the women were getting mastectomies for breast cancer, whereas in Boston, where I trained, 90% of the women were saving their breast. So the cancer was no different, but the surgical approach was very different. And it's time to educate the surgeons that removing the lump is more than enough, and that's it. No wide margins. Another scientific study just out showing in Sweden, in areas where more men were screened and found to have prostate cancer and treated, the death rates from prostate cancer fell. In areas of the country where less men were screened and less treatment was carried out for men with prostate cancer, the death rates were higher. So it's another study that shows that this watchful waiting, that prostate cancer doesn't kill anybody, is probably wrong. And I know there's a lot of men out there who are doing watchful waiting, and watchful waiting may be the beginning of the nail in the coffin of the patient. So this was a study that was reported in the Journal of the National Cancer Institute by Staten et al., and it found that rates of prostate cancer mortality, excess mortality in men with prostate cancer, and metastatic prostate cancer were lower in areas with higher prostate cancer treatment that reflected earlier evaluation of the man and treatment of the man, and these support the contention that more intense PSA screening is associated with survival benefits. So in Sweden, PSA testing is that blood test for men with prostate to try to find men who are at higher risk for prostate cancer. PSA is also used for following men with prostate cancer as well. In Sweden, there was a 400% difference of following men in certain areas of the country versus other areas of the country, and the difference between the high incidence and low incidence was largest in 2005, and since then has been about the same since 2009. There were 4.5 million people years at risk. There were 1,500 deaths from prostate cancer, and there were 1,200 excess deaths in high incidence counties. So it's a serious study. Prostate cancer mortality, that means death rate from prostate cancer, and excess mortality were significantly lower in the years when the screening was most intense, in the areas where the screening was most intense. So lower prostate cancer mortality in high incidence counties reflect a high PSA uptake and more intense PSA screening and treatment. So don't be too comfortable about watchful waiting. Think about how to save your life, how not to die of any cancer. And there's certain things that all of us can do. Stop smoking, eat a healthy diet, exercise, get colonoscopy, stay out of the direct sunlight, get your PSA. For women, pap smears, mammograms. These are very important tests, ways to save your life, and there's great possibilities of each one of us to work to save our lives. What an interesting man who came in this week was an Italian man, 87 years old, with esophageal cancer. He had the usual treatment of surgery, chemoradiation a year ago, and now the cancer's come rip-roaring back at the end of his esophagus. The esophagus is the food tube, the tube between the mouth and the stomach. It's that tube that carries our food. We don't think about it very much until something bad happens. And this man, he had something very bad happen, which was cancer. He went through all the treatments. He did all the right things that were prescribed by his doctors, and now the cancer's come back. It's at the distal esophagus, what's called the GE junction. G stands for gastric or stomach, and E stands for esophagus. So again, he was seen by his usual doctors, and they told him pretty much his time was finished. He should go to hospice, and that was it. But he doesn't want to go to hospice. He wants treatment. He wants a chance to be treated, and he was told if you have radiation once, you can't have it twice. Well, that's not true. We have a large experience re-treating people who have had radiation. That's the beauty of body stereotactic radiosurgery. We can hit the cancer and generally not hurt the healthy tissues. I can't guarantee it 100%, but I'll tell you that most commonly that's true. It's allowed us to treat many patients who thought there were no other options. So he was at his doctor's. He sought out other opinions. He came in with his lovely wife, who's a nurse, and brought in his niece, who was very involved in his care, and went over all the data. We staged him up. Now, 2 months ago, he had a PET scan which showed disease only at the distal esophagus. We staged him up. The cancer spread to several other areas, so he knows exactly where the cancer is. He has a copy of the disc, he has a copy of the report. We made a stereotactic frame, like you heard from John a few minutes ago. We computerized all that information. We're sending beams of radiation in to hit the cancer. We're planning to give a few treatments, just about 5. Each treatment takes about 15 minutes. It's non-invasive treatment. It's painless treatment. He does not want chemo. Chemo didn't work. He doesn't want surgery. Surgery didn't work, and it's not even being offered. We gave him his first treatment on Friday. He's doing well, and we planned 4 more treatments to try to kill the cancer at the distal esophagus, open up the esophagus, let him eat, enjoy life, and do well. And hopefully he'll do very well. If he wants those other few sites treated, those we could consider for treatment in the future. Taking a step at a time. I want to prove to him that we can help him, and that's what we're doing right now. Step by step, non-invasive treatment. When his other opinions told him he should go to hospice, he is functional, doing well, and he wants to continue to be that way. And we hope he would do like the previous patient we talked about, who a year later walked in my office showing he was pain-free for that year. We're going to hear again from some new voices in the world of radiosurgery. If you want to speak to us, call us at 800-321-0710. If you want that booklet DVD, you can call us either today or during the week at 212-CHOICES. Our number is 212-CHOICES because we believe you really have choices. You don't have to take advantage of the choices, but many people do, and for many people, it makes all the difference in the world. So here is a new voice about stereotactic body radiosurgery at our office, Radiosurgery New York.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal too. He's first in America, first in New York, first for you with body radiosurgery. We hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid, accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212-CHOICES.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why Dr. Lederman's custom tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid accepted. Call Dr. Lederman at 212-CHOICES, 212-CHOICES for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212-CHOICES. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the